We are here to cover this particular part of nose paranasal sinus. This is one of the important exam question area where we see these exam questions are teaching every time, and as well as this is one of the topic which is important for our clinical life as well. We see number of patients coming with this particular problem related to the nose paranasal sinus infections, etc., etc. It could be like the trauma which might be involving in this particular nose nasal region, because this is the part of the face which is projected, and this particular part is prone to have infection because of the exposure to this exterior, because this is the organ of respiration. So there are a number of clinical variables are there related to this particular part, and as well as we see this particular clinical question based on this coming on testing your anatomy knowledge as well. So our point of concern today will be covering this particular nose. We'll be focusing on the skeleton of the nose, exterior of the nose, interior of the nose, nasal septum, how it is participating, how it is forming, the blood supply of the nose or interior of the nose, the nerve supply of it, which is related to this particular interior of the nose, and as well as septum. Now then, once we have covered this part of the septum and all these nasal cavity, we will be moving to the expansions of the nasal cavity. We call them as paranasal expansion cavities. We call them as the sinuses. And the opening of the sinuses, if they are blocked, if this particular thing is clinically challenged in terms of infections, etc., etc., then we have to have this particular clinical problem based on this. So this is the point of concern. So first we cover the nose and the nasal cavity, then we move to this particular paranasal sinuses. So to start it, we have to understand this particular skeleton of the nose, which is constituting of partly cartilage, partly bone. So there are some external or extrinsic skeleton network is there, which this particular nose is forming. And as you know, this particular nose is an organ of respiration. We breathe in, breathe out. Along with that, inside to this particular nasal cavity, we have a cranial nerve place, which is the olfactions, which is the cranial nerve number 2. So which is organ of olfactions or smell is there. Along with that, this particular entry point of this air, which have got like functions, which is humidified or dehumidifying the air. What do you mean by the humidifying or dehumidifying? Now, depending on the environment, depending on the moisture we have there in our environment that is getting into this particular nasal cavity to the respiratory tract. Now, we need a particular pH, or we need a particular amount of the oxygen, and as well as we need a particular amount of the moisture in it. So, if you have excess moisture exposed to this respiratory system, which is threatful, if it has a less moisture, which is also a troublesome thing. So, we have to have a proper balance, proper quotient of the moisture there. So if we are exposed to the dry environment, we have this particular nose and paranasal sinus which is secreting, making this particular air moist. And if it is exposed to a moist weather, right now what we are going through is a very humid and moist conditions, this particular nasal mucosa and this component within this particular nasal mucosa absorbs some amount of this particular moisture from the air and delivers the absorbed air or purified air to this particular respiratory system. Along with that, it takes the dust away, micro dust which is present in the air, which is filtering it and letting it get into our respiratory system, the lungs, etc., etc. So these are the gross functions of this particular nose and nasal cavity and this particular the paranasal sinuses, etc., etc. Now our concern is that we will be talking about this particular skeleton of the nose or exterior of the nose. So we have a skeleton of the nose which is made of the external bones or the exterior bones. So we have also mentioned this exterior or the external nose having two kind of skeleton element, which is made of bone, which is made of cartilages. So partly cartilage, partly bone, framing this entire network. There are number of bones which is forming it. There are number of cartilage which is forming here. So we have this particular bone related to the nose, which is known as nasal bone, which is present in the nose, which is framing it. Along with that, the projections and contributions, they are coming from the maxilla, frontal bone, nasal spine, they are contributing to it and forming this external skeleton of the nose. And along with that, we have the cartilages which is present. We call them as lateral cartilage, septal cartilage, which is forming this. But before we going into it, we have to understand different parts of the nose. The part of the nose which is related to the, attached to this particular forehead, we call them as a root. And whereas this particular downward most position, we call them as tip of the nose. And in between tip of the nose and the root of the nose, we have this body of the nose, we call them as dorsum. The projected side of the nose, we call them as ala of the nose. We are familiar with the word ala, which is looks like a wing, which has a nasal expansion, which is coming on the sides, which is known as ala of the nose. Now, if we go on the skeletal section, which is forming here, which I am mentioning, it is framed with this particular bone, which is forming the upper table of this nasal septum, or upper table of this particular external nose. So this is the nasal bone which is making over here, right, left, and this particular bone is coming from this maxilla. So we call them as nasal part or frontal process of the maxilla, which is coming over there. This is frontal bone which is going down and making this particular part. We call them the nasal part of the frontal bone, making a union over there, and nasal spine which is present in this particular region. So this is a skeletal method made of bones over there. Then we go down in the lower part, which is made of partly cartilage, and we have contributions in between different types of cartilage. In the midline, we have a nasal septum. We have to learn a detail about the nasal septum, which is another cartilage which is hanging down. On this side, we have the lateral plates or lateral septal cartilage. Then we have the alar cartilage, which is making this particular different skeletal element of this particular nose or nasal cavity. Now, you are getting into this particular important part for our understanding. We call them as nasal septum, which is splitting this nasal cavity into two halves, right half and the left half. Again, just like the exterior of the nose, the nasal septum is also partly bony, partly skeletal. The anterior part, just like the external nose, is made of cartilage. The posterior half of the nasal septum is made of this particular bone, and this part we have to understand the clinical problem. If you see this particular cross-section picture, this is exposed with this nasal septum. We cannot see the lateral wall in this, and we have used different colors to project it to understand it better. As I am saying, this anterior part of the nasal septum, which is blue in color, you are saying here, is made of the cartilage. We call them a septal cartilage. It is a single plate of cartilage. Now, this posterior part of the nasal septum is made of bone. There are two bones which are making contributions over there. One single piece of bone which is making this particular contribution from the septum on the posterior inferiorly, and on this posterior superiorly there have another bone which is making here, which is marked with the green line and this pink line. This particular bone which is making in the posterior inferiorly, we call them as vomer, which is resting on this particular palatine bone. So this particular vomer is making this particular region, septum, which is below and above by this particular perpendicular plate of ethmoid. Now, this particular perpendicular plate of ethmoid, you see that is continuous with this another plate of ethmoid. We call them a cribriform plate of ethmoid. Now, this anatomy helps us to understand. Now, through this cribriform plate of ethmoid, which is sieve, that means it's porous, we have this olfactory nerves runs from here and goes to the brain cavity. So, over here is this cranial cavity which you are exposed to. Now, if you are exposed to any kind of trauma or not trauma, if we have injury to this perpendicular plate of ethmoid, injuring this bony ends, if you have this particular thing exposed, that can rip and this injure the structure which is lying on top of it. So, we'll be coming again when we are going to discuss some clinical problem regard to this particular cribriform plate of ethmoid and perpendicular plate of ethmoid. So, this septum or septal cartilage architecture we have to know. Moving from here, this particular nasal